Hey there, beautiful humans. Welcome back to the channel. Today we're talking about something super important that affects millions of people worldwide. Breast cancer. I know. Cancer talks can be scary and overwhelming, but I promise we're going to break this down in a way that's easy to understand, informative, and yes, even a little fun. Because knowledge is power, and the more we know, the better equipped we are to take care of ourselves and our loved ones. So grab your favorite drink, get comfy, and let's dive into breast cancer 101. Alright, let's start with the basics. What exactly is breast cancer? Imagine your body is like this amazing city, with billions of tiny citizens called cells all working together. In a healthy city, there are rules about when new buildings, or cells, get built. But sometimes, there's a glitch in the system, and some rebel cells start multiplying when they shouldn't. That's essentially what cancer is, cells that have gone rogue and started dividing uncontrollably. When this happens in breast tissue, boom, you've got breast cancer. The cool thing about our bodies, well, one of the many cool things, is that they usually catch these troublemakers before they cause problems. But sometimes these rebel cells fly under the radar and form a tumor. Not all breast tumors are cancerous though. Benign tumors are like those neighbors who are a little weird, but totally harmless. Malignant tumors, on the other hand, are the problematic ones that can spread to other parts of the body, a process called metastasis. Now, who can get breast cancer? Plot twist. It's not just women. Yes, breast cancer is most common in women, with about 1 in 8 women developing it in their lifetime. But men can get it too. It's much rarer. About 1 in 833 men. But it absolutely happens. Some factors that increase your risk include getting older. Most breast cancers are diagnosed after age 50. Having certain genetic mutations like BRCA1 and BRCA. Thanks for the awareness, Angelina Jolie. Having a family history of breast cancer. Starting your period before 12 or menopause after 55. Having dense breasts, previous radiation therapy. Not being physically active. Being overweight after menopause. Drinking alcohol. But here's the important part. Having risk factors doesn't mean you'll definitely get breast cancer. And not having risk factors doesn't guarantee you won't. Some people with multiple risk factors never develop breast cancer, while others with no known risk factors do. Life's funny like that. So what should you be watching for? Let's talk symptoms. A new lump in the breast or armpit. Thickening or swelling of part of the breast. Irritation or dimpling of breast skin, kind of like the texture of an orange peel. Redness or flaky skin in the nipple area. Pulling in of the nipple. Nipple discharge other than breast milk, including blood. Any change in the size or the shape of the breast. Pain in any area of the breast. But don't panic if you notice something. Most breast changes are not cancer. Still, it's super important to get any changes checked out by a doctor. Better safe than sorry, right? This brings us to one of my favorite topics. Early detection. Why is it my favorite? Because it saves lives, people. When breast cancer is found early, it's easier to treat successfully. So let's talk screening. First up, mammograms, basically X-rays of the breast. They can detect tumors before they can be felt, and show tiny deposits of calcium that might indicate cancer. Most experts recommend women start getting regular mammograms at age 40 or 50, depending on their risk factors. Then there's clinical breast exams done by your doctor, and breast self-exams you can do at home. Getting familiar with how your breasts normally look and feel means you're more likely to notice changes. For people with higher risk factors, there are additional screening options like breast MRI or ultrasound. If a screening finds something suspicious, don't freak out. The next step is usually a diagnostic mammogram or ultrasound to get a closer look. If they still see something concerning, you might need a biopsy, where they take a tiny sample of tissue to examine under a microscope. This is the only way to definitively diagnose breast cancer. I know the waiting period between tests and results can feel like an eternity. That's totally normal. Just remember that most breast biopsies come back negative for cancer. So what happens if it is cancer? Well, treatment has come a long way, baby. The main treatment options include surgery, removing the cancer lumpectomy, or the entire breast mastectomy, radiation therapy, using high-energy rays to kill cancer cells, chemotherapy, using drugs to kill cancer cells, hormone therapy, for cancers fueled by hormones, targeted therapy, attacking specific cancer cell features, immunotherapy, helping your immune system fight the cancer. The exact treatment plan depends on the type of breast cancer, stage, and other factors like whether the cancer cells have certain receptors. It's totally personalized. And the cool thing is, treatments keep getting better and more targeted, with fewer side effects than in the past. Now let's talk about something super important: living with breast cancer. Dealing with breast cancer isn't just about medical treatments. It's an emotional journey too. Fear, anxiety, uncertainty. These are all normal feelings. And it can affect your relationships, work life, self-image, and sexuality. The good news? There's so much support out there. Support groups, both in person and online. Counseling, financial assistance programs, and amazing communities of survivors ready to lend a helping hand or a listening ear. If you or someone you love is going through this, remember, you're not alone, not even close. Now, can you prevent breast cancer? Well, not completely. Some risk factors like age and genetics are beyond our control, but there are things you can do to lower your risk. Stay physically active. Aim for at least 150 minutes of moderate exercise weekly. Maintain a healthy weight. Limit alcohol, but that daily wine habit isn't doing your breast health any favors. If you can, breastfeed your babies. Limit hormone therapy for menopause. Avoid exposure to radiation and environmental pollution. These healthy habits are good for your overall health too. Win-win. So there you have it. Breast Cancer 101. I hope this video has made this topic a little less scary and a lot more understandable. Remember, knowledge is power, and early detection saves lives. If you take away just one thing from this video, let it be this: get to know your body, check yourself regularly, and don't skip those screenings. If you found this helpful, please give this video a thumbs up, share it with someone who might need this info, and don't forget to subscribe for more health content that doesn't put you to sleep. In the comments, let me know what other health topics you'd like me to break down. And remember, taking care of your health is the ultimate form of self-love. Stay healthy, stay informed, and I'll see you in the next video.